begin on a sad note, and a 48-year-old man who shot and killed his partner at Asofie Samain in the Ashanti region over threat of divorce has died. Bashiru Nanayabi died hours after being rushed to the hospital for attempting to commit suicide. He is believed to have taken in a poisonous substance minutes after committing the heinous crime.
Was shot in front of a single-room apartment at the Asofie Samain new site. The area looks bushy with uncompleted buildings. It was a sad moment when 14-year-old Comfort Kulani, daughter of the deceased, narrated what she saw before the death of her mother.
I told my dad not to shoot my mom. I wanted to save her, but I couldn't. He nearly shot me while I was screaming for help. My mom is the only one who takes care of us.
Her younger sister and two brothers, including the deceased stepson, who is older than them, were sitting on a bench outside. A brother to the deceased, Daniel Larry, says the man has 4 children with a sister, though he was yet to perform customary marriage rites. He says the couple settled their relationship challenges the day before the man carried out the act.
After dining with my in-law, I advised him to desist from quarreling with his wife.
Bashiru's daughter, Comfort Kulani, says she will run away anytime he sees the father. She says her late mother, Hamavida, was the one taking care of them.
I will run into the bush when I see my father. I knew my father did not have any good intentions for us. It's my mother taking care of us.
The suspect has been arrested and is in custody of Asofie police. The police suspect he has taken a poisonous substance and needs medical attention. The body of the deceased has been deposited at the Confanati Teaching Hospital mortuary.
Now, as Prince Apiat reported earlier in News Desk, the suspect has passed. Now, we move to other stories, and the Ashanti Regional Security Council has entreated all municipal and district assemblies to team up with security agencies to enforce all restrictions on public gatherings directed in the President's last address on the pandemic. Already, police have taken up the charge enforcing nose mask wearing protocols in the Central Business District of Kumasi. So far, 1,253 cases of COVID-19 have been recorded in the region, with the new Delta variant driving the new cases. Ashanti Regional Minister Simon Osei-Mensah says all MMDCEs should take steps to halt the spread by ensuring punitive measures are adopted.
With the onset of the new variant, that's the Delta variant, Ashanti region has seen a very sharp upsurge in the number of cases. Because of this, it has become necessary to tighten the enforcement of the various COVID protocols within the region. And the security agencies are going to ensure that we abide by or we observe all the COVID protocols. We are urging all the metropolitan, municipal, and district chief executives to join hands with the respective security councils to undertake the following. 1, ensure mandatory wearing of face masks in all communities. 2, provide Veronica buckets at public places, including markets, lorry parks, and health centers. make public announcements to increase awareness of the new wave and the need to enforce the protocols. And also enforce all restrictions on public gatherings as spelled out in the President's 26th address to the nation on the COVID situation. With regard to public transport, drivers are to ensure that everyone who boards their vehicle has the face mask on. In the event where the security agencies meet a commercial vehicle and a passenger is not masked, all the other passengers will be asked to alight, and the driver, the passenger who is not wearing the mask, together with the mate, will be taken to the police station for the law to take its course. Wherever you will be moving in this region, please, we urge everybody to put on the face mask. And we wish to inform the general public that the security agencies will be deployed all over the region to ensure enforcement of all the COVID-19 protocols.
Now, a total of 664 new COVID-19 cases have been confirmed by the Ghana Health Service as of 29th July 2021. It takes the country's active case count to 5,928. Out of that, 17 are critical and 86 severe. More worrying are concerns from the West Africa Center for Cell Biology and Infectious Pathogens, WACBIP, revealing that deadly COVID-19 Delta strain has finally taken over infections in Ghana. Director for the center, Professor Gordon Awandari, who spoke earlier on Joy News Desk, says the latest study revealed the Delta strain constituted about 90% of community spread in the country.
It is just confirming what was inevitable, because everywhere Delta has been, it has taken over. So it was just a matter of time before it dominates, and that has now happened. What was also interesting for us is that there's another variant which was making a lot of progress in taking over, and then Delta has come and basically suppressed that one as well. So, but we need to keep an eye on it as well. It was one of the variants that was driving the outbreaks in Mauritius a few months ago. So it's called a B11318, and it's a variant that has been in our system for a while. We need to keep an eye on it as we also track the Delta variant.
So the Ghana Medical Association has raised this concern about the need for us to be more careful. You just heard Dr. Bayo talk about how leadership needs to basically take that responsibility and ensure that the citizens are protected. Would you agree with the GMA position?
Yeah, I think that, Titus said it all. Is the enforcement. If you look at the history of the waves we've had, the first and the second waves, anytime we crack down on the protocols and enforce them, and people start wearing their mask again at a high percentage, you see that we overcome the wave, and then we come back to a certain level of normalcy. So I think that is what is required, that we present a more, a more heightened state of urgency for the enforcement of the protocols, and for the language to change from, sort of saying that things will be okay, to actually telling people that no, if we are not careful, we can get into big trouble. If we can do that for a few weeks, I think we can get Delta under control as well, like we did for Alpha in January. But definitely, this is the most vicious variant we've ever had. Everywhere it has gone, it has left some damage. So I think we have to be very careful.
Now, as you heard me ask Prof. Awandare earlier, the Ghana Medical Association is raising concerns about the surge in cases. Deputy General Secretary of the Association, Dr. Titus Bayo, wants governments to enforce the protocols and double up efforts to procure vaccines to save the populace.
Everything stopped with leadership, leadership at various levels. We think that the leadership of the country needs to play a role, but we are also calling on individuals to take personal responsibilities for their health. And now when you talk about leadership at the national level, we think that continuing to urge people to obey or enforce, obey these protocols is not working. It's simply not working. So we think there's a need for some form of enforcement of the protocols, and that's where national leadership come in. If you take something like the vaccines, we think we cannot wait any longer. And we stated that clearly in the statement. And that is not something an individual can do for themselves. We recognize the effort government is making toward these vaccines, but it's only government that can do it for us. And so we are calling on government to work on that. And then on the individual level, we are asking people to try and comply with the protocols. But like I said, it will require enforcement from government and the forces that be to ensure that people protect themselves from harm. If we are on a path of a self-destruct, we need somebody to reverse the trend. And we think that government has a responsibility to enforce these protocols on everybody. It's become so common, let me put it that way. And that's just what the story is. And that's why we said that our healthcare systems continue to be very fragile and we need to up our game. Because if you check from the healthcare point of view, health worker point of view, if you go to the northern and upper part of our country, most of our healthcare workers have received a single vaccine only. So they've not had the opportunity to get a second shot of the vaccine. If you come to the Greater Accra, Ashanti, most people got the 2 shots and therefore seemingly are protected. But this Delta variant is a very, very, very stubborn one. Even people who are vaccinated get the infection. And so people have genuine concerns about the rising numbers. And for us, our biggest concern is that when the numbers begin to rise and we sound the alarm bells, people get the assurance that, oh, just take it easy. These numbers are not much. We are not seeing a lot of sick people or people dying. But it's just a matter of time. We know that our capacity is better than it was in March last year. It's better than it was in March this year. But the truth is that it is just a matter of time. With these numbers going up, and if more people get critically ill and will require in-hospital care, we cannot cope. And then we'll come to the point where our phones are going to be inundated with calls or people trying to get ICU beds for relations, trying to get oxygen for relations and stuff like that. So I think it is earlier, the earlier we take a decision, the better it will be for all of us.
Meanwhile, in a related developments, the Ghana Health Service has denied allegations of poor COVID-19 testing among passengers at the airports, saying such viral complaints are erroneous. This follows concerns raised by some individuals and the minority in Parliament over what they say are discrepancies in the outcome of COVID-19 testing. Here's Dr. Franklin Esiedu-Bekwin, Director of Public Health at GHS, giving modalities for the testing.
Let me say that protocols or guidelines are not static. I mean, they are meant to be reviewed. And when you are managing a pandemic, it's kind of a trade-off. So your main focus is to seek the safety of the population. So somehow, not the best, but we have to side with the population against that individual. But I think that based on whatever is going on, I think that as a country, we need to look at it. We have moved on based on our guidelines over the period. For now, as we speak, we do not have that space that you contest the results at the airport. But it's not a static situation that we may not need to amend it. What we are saying is that we were looking at a very sensitive instrument, which is the antigen test. So because it's so extra sensitive, it's about 99.9, it's possible we have a few false positives. So let me say that even those who are making the comments, there are instances that people have somehow doubted the results, but with time, they've come to accept that that could be true. You see, for science, there's not like absolute. I mean, that's the science.
Yeah.
So, and there are individuals who have different idiosyncrasies and different genetic makeup. So you cannot be very, that's why we give ranges. So if you look at the spectrum of persons coming from outside to the country, so there's a starting point, which is that do a test. And then the test is that you do an PCR test. And we are saying that be negative. There are instances that people have come to Ghana with a positive PCR test and the airlines have been fined. If you do that, we fine you $3,500. So the idea is that the airlines should be watchful to be sure that people who are entering your plane are antigen negative.
Right.
You see, when somebody is coming, let's say, assuming somebody could be at the early stage of a positive status, but then to be negative. And he comes to Ghana, and then antigen is positive. That guy can, after 2-3 days, move from antigen positive to antigen negative. It's possible. I mean, let me be also clear. When you have people who have been vaccinated, and whereby they have high utilizing antibodies, they have a high probability of clearing their virus. So there's nothing like a no-no in science. And I think that we need to be realistic with the issues going on. We are not saying
that's interesting.
Listen, let me say, we are not saying that there could not be false positives. What we are saying is that we need to be realistic and then move on with it.
Live on Jaw News today with me, Daniel Daza. Now, Idra MP Mohamed Brima says the report of the 3-member committee that investigated the violence there should have recommended the removal of the regional minister. He says the recommendation for the removal of just the MCE is not enough. He tells Jaw News they are dissatisfied with the recommendations. Let's go live and speak with Joseph Opoku Gakpo. Now, Joseph, you were speaking with the Member of Parliament. What more did he say? Right, Joseph Opoku Gakpo joins us shortly. Meanwhile, we know that the 3-member Justice Kingsley Kumsin Committee, or Justice Kumsin Committee, pardon me, presented their report which recommended, among other things, the removal of the Municipal Chief Executive for Idra Setre Dumase Mohamed Brima. Now, we know that Mr. Brima has already indicated he would not be contesting for the position of MCE. He withdrew his application for the position of MCE even before the committee made that recommendation. They also said that some sanctions are preferred against specific persons. Let's get details of that from Joseph Opoku Gakpo. Joseph, what more did we learn from Mr. Brima?
Well, the MP says that from the details that he is gathering, the committee has recommended, among others, that sanctions should be applied against the MC for the area, who he says is a small fish in the whole scheme of things. The Idra MP says there's also been recommendations that sanctions should apply to the military officials who are not on the ground. And for him, these two recommendations are not far-reaching enough. He argues that when you look at these two special recommendations, there are military people who gave the directive in terms of the set deployment of military people to the area. And as far as he's concerned, the chairman of the Regional Security Council, the Ashanti Regional Minister, Simon Osaimensah, is also the individual who did the deployment of the military people, which ended up in the 2 deaths in question. And so he's asking that sanctions be applied against the regional minister as well, apart from the MC that the report is recommending, that he be sanctioned. And, he makes the point that they in Nigeria want to see a recommendation of the committee's report and an avoidance of the situation where it will be shelved under the carpet, as he claims, like the IR Workshop and Commission's report was shelved under the carpet.
Right. Right, Joseph, what else is happening on the floor of Parliament?
President of Angola will be in Parliament by 2 p.m. He's actually in Ghana on a state visit. He's expected to address the Parliament of Ghana. So that's expected around 2 p.m. This morning around 11 a.m., the meeting of the committee that's probing the Sputnik contract issue began a meeting around 11 a.m. today to deliberate on what the way forward should be. Their time in order for them to submit their report has already gone past, but the indication is that the report before Friday, and so we gather that they're fine-tuning that particular report in order to get it presented to the floor.
How will the fact that Parliament is going on recess this weekend affect the work of the Sputnik V committee?
From what we're gathering, they are virtually done with the necessary interrogations and the writing of the report. We gather that there is a bit of a disagreement in terms of the recommendations that should come from the committee, with some of the specific things disputed. It's pulling off both sides. We reliably gather that if these disagreements roughly persist, we can expect a minority report separate from what the chairman of the committee will be presenting. And so we gather that it's at this meeting today that the fine details will be firmed out in order to allow for a decision on how the way forward will be.
Right. Joseph, I'm curious. I did see earlier that there are those who are calling for the removal of Kwabena Mintah Kando from the committee, from his position as vice chairman. Is that the case? Can you hear me, Joseph? Right. You're live on Joy News today. Parliament is concluding a debate on the mid-year budget review presented to the House by the Finance Minister Ken Ofori-Atta. The leaders are now taking their turn to debate the content of the document. Let's go back to Joseph for those details. Joseph, tell us more about this debate on the mid-year budget review. We'll get those details from Joseph later. Now, after failing to raise enough money for orthopedic surgery, a 56-year-old woman suffering from complications in a motor vehicle accident is battling for her life. Her reliance on herbal and traditional treatments rather than specialist medical care has resulted in the deterioration of certain bones in her upper left arm. Her condition is worsened by a continuous abnormal and excessive bleeding. Doctors say Janet Efriye requires immediate surgery to prevent bone loss and correct fractures in a deformed position. Oheming Teria of our health desk has more.
Madame Janet Efriye hails from Banko near Efjase in the Ashanti region. The widow is surrounded by her 7 children in front of her room. Here, she withers in pain as she rests her bandaged left arm on a pad. Madame Efriye, a trader in fruits and vegetables at Kumasi Central Market, was returning home with 2 of her kids when disaster struck on the outskirts of Banko. They were a few minutes away from home when the taxi they were traveling in somersaulted several times after a head-on collision with another car at about 7:50 p.m. on August 6, 2020. She had asked the driver to kill his speed before the accident occurred. That accident has rendered her left arm ineffectual, and her condition keeps deteriorating as several bone tissues are destroyed. The once vibrant and active breadwinner of the family is now forced to survive on the benevolence of others. Doctors at the Pope John Paul II Medical Center in Jamasi say Madame Efriye needs urgent medical surgery to correct her worsening condition. Dr. Simon Berkon is a medical officer at the facility.
The bone setters couldn't really help to restore the arm into its functional state. And therefore, there's what is called more union. And because of that, she apparently cannot do anything with that limp. It's extremely bad to the sense that she cannot carry anything, she cannot hold anything. And so basically, the arm is just there for the sake of it.
The widow has also been suffering from postmenopausal bleeding, a disorder that causes her to bleed abnormally and excessively for several months after she has reached menopause.
Because the mojana etuno, the mamuja need to mean in sanum. Cause now saying in a jurega a buyeno, a sonu bubu sinisni, inti egum keke. Ama Nensa wina emoja nintimin femuno. I start April.
Medical experts fear Madam Janet Afriye may be suffering from endometrial carcinoma, cancer of the inside lining of the womb. Dr. Foster Kwaununu is a consultant obstetrician gynecologist at the Komfanochi Teaching Hospital.
Every postmenopausal woman needs to have the inside lining of the womb not to be thicker than 4 millimeters. But from the scan that I have seen, she has about 13 millimeters or 1.3 centimeters, which is about more than 3 times the average thickening of the endometrial lining.
An urgent diagnosis and treatment have been recommended.
The biggest problem in this woman, which is already suffering, is the continuous bleeding, and that can push her into to become anemic or loss of blood to the point that her blood levels will be low, and that alone can even kill her. This endometrial carcinoma can also spread to other parts of her body and give her the problems and then kill her in the long run.
Unfortunately, Madame Afriye, who lives on the benevolence of residents of Banco, cannot afford the cost of treatment. In her current living state, it will take years for Madame Afriye to raise the money for her treatment.
We need support. The support that we can use to maybe remove all that sickness from his stomach and treat what is happening in the house so that she will be set free.
Until help comes, the life of Madame Afriye and that of her 7 children will continue to hang in the balance. From Banco in Ashanti region for Joy News, Ohimi Nteria reporting.
Now, Procurement Express Kobna Tabedu has described the explanation offered by spokesperson for former Works and Housing Minister Collins Dauda as a red herring. He says the variation of the contracts to construct 5,000 housing units at Saglemi without recourse to Parliament is a breach of the procurement regulations. Collins Dauda's spokesperson, Eric Opoku, said the monies expended on the project during his time at the ministry were disbursed directly from the Finance Ministry. Mr. Dauda has been charged with causing financial loss to the state in the Saglemi housing deal. He has, however, been defending his role in the execution of the project through his spokesperson.
The paying agency has nothing to do with it. In construction, you appoint a construction consultants who are project managers. The Finance Ministry is only the paying agency, the disbursement agency. They will pay whatever payment certificate you certify. So the question is, who did the assessment of the works? Who measured the works and certified? Which they issued a certificate based on which finance will pay. What he is talking about is a red herring. As soon as Atachia took office, he flagged it.
We apologize for playing the wrong inserts there. That was Kobna Tabedu that you just heard. He is the procurement expert. Many thanks for joining us. This has been Joy News today. Up next is business.
Hi, good afternoon. Welcome to Business. My name is Daryl Kwao. Ghana is set to receive more than $1 billion in special drawing rights from the International Monetary Fund in the coming weeks. This is after the board of the fund approved a record $650 billion to be shared amongst member countries. It is aimed at assisting countries like Ghana deal with rising debt and fallout from the COVID-19 pandemic and its impact on economies. This facility which will aid economic recovery, is not a loan, grant, and cannot be described as a financial package under the program. It is rather a special arrangement that the IMF has put together to help member countries fight the COVID-19 pandemic. Countries like the UK and US can also enjoy the special financial support. This is the first time that the fund has put together a deal for members after the global financial crisis in 2009. Well, meanwhile, the International Monetary Fund is warning that the country's rising debt stock and negative impact of the third wave of COVID-19 could force the country to seek financial support from the fund. This was captured in its latest staff report on the country. Now, Head of Finance at the Valley View University, Dr. Williams Pipa, is asking government not to hold back on going to the IMF for support. He says it is not a matter that should be politicized.
The fund has some funds available for COVID situations. We benefited from the first $100 million. We can go to the fund and tell them that our cases are rising and it's affecting our economy. There is a danger that possibly we might have to whether do another lockdown if the cases don't go down. Then the fund can consider. Whilst we also find a way to strategize in reducing our expenditure. If the government is able to reduce the expenditure, which I think is very difficult now because of the numerous strike actions. We know that now the university lecturers are on strike, and we have also heard of GUTA also resisting some measures from enforcement rules through the tax enforcement. These are signals that we have to be careful. I'm sure the moment government gives in to the university lecturers, other institutions will also follow for increment. And in effect, we will not have the money to pay. So we have to start talking to IMF. And it's good that even IMF is not waiting for Ghana to apply, but they are doing their own stress test analysis and trying to make sure that we have some money available. Let me give you what happens. What IMF does is that IMF looks at the global impact. Should Ghana be affected financially in a high financial distress, what will be the ripple effect in West Africa? Because don't forget that in West Africa, in terms of numbers, Nigeria has the numbers, but in terms of other businesses, Ghana is controlling the businesses. And if Ghana should be affected, it's going to have a ripple effect in our economy, especially West Africa. So that is why IMF is paying much attention to our situation. We shouldn't let the politics of going to IMF and this NDC, NPP matter. But the situation is that is the only place we can get a cheaper source of funds. And you might even get interest-free loans from them.
Well, away from the IMF, demand for labor, determined by the number of jobs advertised in both the print and online media, remained flat in June 2021. This is according to the Bank of Ghana's survey of the labor market conditions. Charles Nixon Yeboah has been looking through the job charts and has more.
This is coming following an improvement in the number of advertised jobs between November last year and March this year. At this period, the COVID-19 infections in the country had eased significantly. According to the Bank of Ghana, the number of advertised jobs after going up in late last year and the first quarter of this year remained flat in the second quarter. This is because of the probable second wave of COVID-19 infections, which has now compelled the government to announce new restrictions. About 7,250 jobs were advertised during this period, as against more than 9,000 jobs registered in the first quarter of this year. The services sector maintained its dominance as the leading job providing sector in the economy, accounting for 83.1% of total job adverts recorded in the first quarter of this year. Industry followed with a share of 13.5%, marginally down from 13.6% recorded in the first quarter of last year. Further analysis by the central bank revealed that the main requirements for skilled employees were tertiary education qualification with a minimum of 3 years working experience.
And there's more on our top story this afternoon on the IMF. Ghana others to benefit from $650 billion fund from the IMF to fight the impact of COVID-19. That's on myjoyonline.com/business. Up next is sports.
Hello there, good afternoon. Welcome to Showbiz here on Joy News today. Now, Ohima Mercy says she will only collaborate with a secular musician based on the person's lifestyle, contrary to views held by some industry players about gospel musicians collaborating with secular musicians. The Otimimo hitmaker says so far as the lifestyle of the individual is pleasing to God, she will collaborate with them.
We have plans of releasing songs right after Tahila Experience. I'm releasing another single right after Tahila Experience. From August to December, we have a lot of package for you.
The collaborations in there?
Yes, we have some collaborations, live sections, and all that.
You know, some of the collaborations I can actually guess, but the ones that I can't guess is the one that you might be having with a secular musician. This thing about, you know, most, I mean, I can't say for everybody. It's about, you know, gospel musician not collaborating with secular music, because they are not like, they are also human beings, they are musicians.
Of course.
What will make you collaborate with a secular musician, and what won't make you collaborate with a secular musician?
Hey, question they are not doing. But I think it's a lifestyle. I have a lot of friends that are secular musicians. Yeah. But I select because I love to be with positive people that their lifestyle really speaks a lot. So if I would choose anyone to collaborate with, specifically if the person is a secular musician, it's the lifestyle that would draw me close to the person to do it.
Okay. I won't force you to mention it. I wanted to force you to mention it. Yeah. Oh, yeah. I get it. I get it. Meanwhile, gospel musician Yao Sapon says he has no problem collaborating with a secular musician. He thinks there's absolutely nothing wrong with a gospel artist working with a secular musician.
Yes. I have sung with Sarkodie, Kofi Kinata, Samini, and we are in the studio with that guy.
Was it
Stoneboy?
Oh, you're in studio with Stoneboy.
Yeah, we're in studio with Stoneboy.
So what necessitated that move to record with secular artists? Because some gospel musicians don't believe in you know, collaborating with the secular musicians. Why, you know, all of these people?
The fact is that in Bible, Jesus told us that we should go outside those who haven't seen the light. If we believe ourselves that we have seen the light, we should let them also see the light. So let's say if they are in the world, we're supposed to bring them back to God. That's the reason. And as for Sarkodie, he was have an engagement in I think US, and one of the stations were just interview him like the way you are doing. Yeah. And he asked him what music did he like, and he said, "Me, Yasapon is my favorite artist." And the guy asked him, "So if Yasapon ready to go studio with you to help to go and do collaboration. He said, "Today, if he comes today, I will do." And he asked him, "What about you?" And he said, "I have a project doing, but after that, maybe I'll confront him, or if he confront him." One of my guys called me to listen to what Sarkodie is saying in US, and I went to one of the websites, and it's true he was talking about my music. So I called him. The other time I called him, and he responded to me, and he said he's ready to hear the kid.
Well, on that note.
On that note, we are waiting for your collaboration with Yao Sapon.
Okay. Why? Am I a secular musician or something?
No, you're a rapper. Oh, please. Don't let me talk about your escapades in the news. Okay.
I mean, I want to be everything else in this life, but not a rapper.
But not a rapper?
Yeah.
Oh,
I'm an actress. I mean,
that's the anointing that came, I'm sorry.
Praise the Lord.
That's it for this bulletin of Joy News today. My name is Daniel Daze, and
for more news, log on to myjoyonline.com. That's where you find all the news. My name is Becky.
Yes.
And we'll be back tomorrow, right, Daniel?
Yes, indeed, we will. Up next, though, is the marketplace. Have a good day.